The sheriffs rolled up on scene and actually caught the guys fighting dogs, like, in the act. He says she's the one that had a hold of the red one, and the red one had a hold of her.
They said they had a hold of each other. One had the neck, one had the leg.
One is a very sweet, tiny little black dog that we're just calling Black Dog.
Okay, come on.
And the other one was a larger red female pit bull. It's just covered in blood. Oh, yeah. There's some cuts inside.
Oh, no, her mouth is bleeding.
Okay. They were all very sweet dogs with us, except for the black and white one, who the neighbor yelled out to us, "Don't go near him, he bites everybody." And he was wearing a really heavy chain. At that point, all we could do is just pick up this chain and just toss it in the crate with him, and then, you know, figure it out later. There you go. Come on, bud. Yeah. There was a male pit bull that had really bright blue eyes.
The cop said this is like his pride and joy.
Oh, well.
Apparently.
And had shown signs of, like, what they call, like, rickets, where the muscles in their legs don't develop properly and they're all bow-legged.
Yeah.
Oh, my God. All that was because of poor nutrition, poor feeding. That's when it makes it worse.
Oh, she's got a pink camo collar.
Oh, I'm gonna try to say it without getting emotional, because I don't want to go there. The smallest little pit bull that we're just calling Tiny for now. She was all bit up. She's got cuts on her, she's got cuts all over her front legs. Oh my God, look at her face.
That's what I'm saying, yeah.
She is cut
Look, she's
up.
got an infection right here.
Cut up. When you see the little one, she was obviously just tossed in to use as a chew toy, you know, and she's so scared and she's tiny and you're like, oh my God. See these, Aaron? These are all old bite marks.
You're okay.
That's what these are. Back here, another one. These are all old bite marks. Yeah. What kind of a man takes a little 25-pound dog and just says, "Here, have at her"? Oh, these are bite marks.
Yeah, those are fresh on her leg.
Yeah.
Okay, come here.
That was like the worst part of the whole scene for me.
Okay, hold on.
Even after assessing them and seeing who had the fresh wounds, who had old wounds, at the end of the day, it didn't matter. All 5 dogs needed to go to the vet.
And we'll go straight to the scale again. I was really worried about the dog that we named Blue Eyes.
You are sweet. Ooh, that makes me cringe to look at those front legs.
I know.
The male dog that they called Blue Eyes, he had what we call carpal varus, where his paws actually turned in from his wrist. I think it was either a trauma or a nutritional deficiency that wasn't taken care of. Whatever happened, it's pretty severe.
Yeah.
And obviously, you can imagine, you know, trying to walk on that, it's gonna put a lot of pressure on the ligaments and the tendons and everything. But I think we should take x-rays and see if his growth plates have closed. Growth plates are at the end of the bones where the growth occurs, the lengthening of the bone. And when you're a baby, until you're an adult, they grow and they're supposed to close around 9 to 10 months. And I think he's at least a year. Sometimes if you still have a little bit of a growth plate, you know, open,
You have a chance of
there's a few things we can do to really help him. When they're still open, there are surgical procedures that aren't as dramatic that can really help him grow correctly.
Good man.
You should be able to tell from the x-ray if it's closed. All right. Growth plates are all closed.
Oh,
Oh no.
well, that's not good news, man.
You can see how crooked they are. So like this is like the hand portion of it, and then this portion is like, you know, up here, and it's
supposed to be
rotated.
that way, yeah.
You're supposed to be able to see the radius and the ulna, and you know they'd have to have like orthopedic surgery where they would cut the bone and like a, you know, chunk out of it and plate it.
Yeah.
You know. He will need to go see an orthopedic surgeon where they will actually take a piece of the bone out and kind of realign it. You know, his body is gonna give out before the rest of him does, you know. It's a very major surgery. Obviously, you're breaking his bones and resetting them, and it takes months and months of healing, and, you know, things can go wrong, so it is a huge surgery to ask a dog to do. I know there's a lot going on. Like, is it necessary for his survival? No.
No, yeah.
But is it
For
necessary?
comfortability.
Yeah, for him to live the longest, happiest, healthiest life, I think absolutely.
It's sad to know that just, you know, good nutrition could have prevented this. Who knows that one surgery will fix it? It just sucks that something so simple could have completely prevented a lifetime of pain and suffering for him. We will get the next one. All the dogs did pretty well and cooperated with Dr. K, but the last dog that we had to bring in was the dog with the chain, and that was a little bit more aggressive when we rescued him. We named him Cuzzy, and he was just gonna be a little bit more difficult. It's okay, go ahead. I got it with my foot. We gave him an oral sedative that kind of calms him down, takes the edge off, and we gave that to him before I even started the dogs. We wanted to get the chain off, and we wanted to be able to assess his medical, even though, you know, he may not like us, but we need to take care of him.
Oh my goodness, that's like a chain.
I know. Now, he is super into food, so I don't know if we can maybe feed him. He makes me a little nervous. You could tell he was still very aware of what was going on.
I mean, I prefer not to have to do any of this, you know?
Yeah. He was taking food really well. He had a very big appetite, so we kind of used that to our advantage.
Good boy, there we go.
Dr. K had an idea to kind of move his crate around and kind of maneuver him in the crate to where he was close to the side.
Food.
Good boy.
She was able to just poke him with a needle that is a sedation med, and you know, it immediately calmed him down.
He really didn't even seem to notice that the kennel was moving.
He didn't even notice she poked him.
No.
He was so into the food that he didn't even flinch.
That chain is insane.
It's... Okay. You're free, bud, you're free.
This thing, you should weigh it and see how heavy it is.
When we weighed him, he was 41 pounds.
Almost 20 pounds.
When we weighed the chain, it was 19 pounds. So for his entire life, he had basically been carrying around half his body weight with his neck.
He's good and sedated.
Since we can't handle him, we just did everything.
Poor buddy.
You know, we were able to clean all his infection, all his bite wounds. Have the best looking nails out the group, man. And just make sure that, you know, he was okay. All right, baby boy. Rise and shine, Mr. Man. All 5 of the dogs were heartworm positive. They were full of hookworms, and they each had infection going on. They all had to be on antibiotics. It's just a process to get better. Hi.
These are all sweet dogs.
Yeah. She's like, I don't care, you're touching me, I'm happy. You're okay. You're okay. Good boy. Good job, baby. It's pretty remarkable, these dogs and how they act coming out of these situations. You know, they've only known sadness and pain. Oh, look at him. He's like, let me give you kisses. I know, she's so sweet. But yet they're letting us, you know, people that they've never met, you know, love on them and pick them up. Thank you so much. Thank you for everything. Alrighty. The next step at this point for these dogs is to have them get healthy. And we really want to get to know them and spoil them and give them as much TLC, and then hopefully they'll get a little bit more comfortable.